If you're not careful, that's why we are there for safe anesthesia.
Okay.
So always there's like a qualified anesthesiologist available for these major procedures. Yes. So I think for most of these patients, we do general anesthesia. So in general anesthesia, basically we have the same. We keep the patient unaware, unconscious, and pain-free, and also they have no memory of what has happened. So
have you encountered any common complications that would come along with that, any form of risk, and especially at this point when we're talking about bariatric surgery, and just how then do you get to handle them? Because I want to believe that these cases are in existence, and I have seen patients who say, can I just go through this process without having to undergo that, in as much as most of the medics would recommend for that?
Yeah. So obesity itself, it comes with many risks, many challenges. So when we think about anesthesia, the main, not the main, but we are worried about the airway, breathing. We are also concerned about the cardiovascular issues. So for most of these overweight patients, we are worried about their airway.
Okay.
So there are some anatomical changes which happen for these patients. So we have a lot of lingual fat around the mouth. We have like a larger tongue volume. And then also the neck becomes shorter in these patients, more muscular. So very difficult for neck movement for these patients. The neck has, usually they have a lot of adipose tissue around the neck, around the chest, around the abdomen. So it becomes very difficult sometimes for ventilation, intubation. So I think for safe anesthesia, what we normally do is we try to anticipate. So we normally see the patients, we anticipate what can happen, how is the airway, what can occur during the procedure. So we prepare for it.
Okay.
And there's always like difficult airway like guidelines, like what we follow through. So we have adjuncts, airway adjuncts like laryngeal mask airways, which is very easy to use if you are unable to intubate. If you need to intubate a patient, we have video laryngoscopes, fiber optic bronchoscopes, which makes it easier now to do those things. So yes, in an overweight patient, it is difficult, but now things are made easier. We try and make sure that things are safe.
Okay.
Yeah.
All right. Before we come to you, Mika, briefly, Anne, Dr. perhaps will be telling us just how then he recommends that this is the right procedure that you should go through, because sometimes people come there green with minimal understanding of what they expect. If there is anything that they understand, perhaps it's just what they have read online. But where then does an aesthetic nurse practitioner come in this particular case, even as you walk us through what it is that you went through, or what it is that you picked as an option?
Okay, so when we talk about entry point to a person who does not know what options are there, they come green. They will actually equate weight loss to some jabs that are given every single month. And they will ask you, can I be getting this every month? So the first thing is to educate, like just a very basic education. And this is based on, number one, so-and-so, XYZ, you want the weight loss program, or you are intending to have the weight loss program. What do you have in mind? First of all, getting to know what they know, so that you can be able to know at what point you come in, So the first thing that I will always ask them as an entry point now, before they get to Daktari, is how much weight do you weigh right now, and what is your desired? Why desired? There's what they have as a picture in the mind, but then there is what is possible with even any option. So being able to merge the two conversation now brings a chance for a comfortable appointment scheduling. And this is now where we are able to tackle it at my level, what they know, what understanding they have, what is real from Daktari, and now at the point that it will be about us giving the solution, what part do they play? Because in the weight loss, there's what the team can do, but there's so much that you have to do.
Yeah.
So are you willing?
An individual.
Yes, as an individual. Because the minute the two do not correlate, trust me, the outcome is somehow not always 100%. And that is now where Mika comes in. There's a lot of change that has to begin. And this starts from a normal talk between me and them. Like, why do you want this program? Why do you want the change? Is it for aesthetic reasons? Is it for condition, because you have conditions and all that? So first of all is understanding what this person wants and what they know, and then we build it up.
Okay.